You hear a consultant rheumatologist talking to a patient called Mark Daniels. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Sally. I'm Dr. Saunders, consultant rheumatologist. I understand your GP referred you to us due to some ongoing joint symptoms?
Yes, that's right. Thanks for seeing me. It's been getting a bit frustrating, to be honest.
Of course. Why don't you start by telling me what's been going on?
Sure. So, it started about 7 or 8 months ago. I began waking up with really stiff fingers, particularly in the morning. I didn't think too much of it at first, but it's been happening nearly every day now.
Is it just the fingers?
At first, yes. But after a while, my knees started swelling every now and then. It comes and goes, but it makes it hard to move around, especially if I've been working all day.
And how long does the stiffness typically last in the mornings?
Usually around an hour, sometimes longer. I try to shake it off with a shower, but it doesn't go away quickly.
That sounds quite significant. Any other areas involved?
Yes, actually. I've had quite a bit of pain in my lower back too. It's more of a dull ache, but it can be pretty uncomfortable when I'm sitting for too long.
Is it affecting your mobility?
Definitely. I've noticed that climbing stairs has become difficult. I get a kind of aching pain in my thighs and knees when I go up.
Okay. Have the joints been red or warm to the touch?
Sometimes, yeah. Especially in my wrists, they get red and hot, and it looks a bit inflamed.
How's work been going? I understand you work in construction?
Yes, I do. And to be honest, it's been tough. I often have to squat or kneel for long periods, which makes the pain worse. The stiffness slows me down and I'm constantly worried I'll get behind on jobs. Yes, I do. And to be honest, it's been tough. I often have to squat or kneel for long periods, which makes the pain worse. The stiffness slows me down and I'm constantly worried I'll get behind on jobs.
Are you on your feet most of the day?
Yes, but it's more the crouching that really affects me. Especially when I'm working under sinks or near flooring.
Got it. And any family history of arthritis or similar conditions?
My mother had rheumatoid arthritis, I believe. It started when she was in her 40s. I'm 38 now, so it's playing on my mind a bit.
I understand. Outside of work, do you do any physical activity?
I used to jog a bit, but I've stopped. It makes my knees feel worse. Now I mostly try to go for walks, but even that's becoming less regular.
Are you taking anything at the moment to manage the symptoms?
Yes, I've been taking ibuprofen every day for the last couple of months. It helps a bit, but not enough. Sometimes I take paracetamol as well.
Understood. How's your sleep?
Not great. I wake up in the night because my joints ache, or if I roll onto one side and put pressure on my hips. I've been feeling more and more run down lately.
Do you mean physically tired, or emotionally as well?
Both, really. I feel exhausted most of the time, even if I haven't done much. And my mood's not great, I feel a bit down, which isn't like me. I'm usually pretty upbeat.
Any other symptoms you've noticed recently?
Actually, yeah. I've dropped a bit of weight without meaning to. Nothing drastic, but my clothes are a bit looser, and I haven't changed my eating habits.
Okay, thanks for sharing all of that. What I'd like to do first is run some blood tests. We'll check your inflammatory markers, like CRP and DSR, and also look at your rheumatoid factor. That'll give us an idea if there's an underlying autoimmune process.
Right. Sounds good.
We'll also get some x-rays, definitely of the pelvis and spine. That'll help us check for early signs of any structural joint damage.
Okay, doctor.
If things don't settle with basic treatment, I may refer you for an MRI down the line. It's more detailed and can pick up earlier changes that X-rays sometimes miss.
That all sounds reasonable.
In the meantime, I'd encourage you to pace yourself and avoid long periods in one posture, especially crouching. And try to maintain gentle physical activity, it helps keep the joints mobile. Also, if you can, try to reduce the ibuprofen a bit. Long-term use can affect the stomach and kidneys.
Right. I'll try. Thanks, doctor. I appreciate the help.